30th. My name is Kemal Erkan. I'm the chairman of American Surgery Center with the Bariatric program, and I have Dr. Isaias Irgau with me today.
Hello, I'm Dr. Irgau. I'm the president of CHRIAS, or Christiana Institute of Advanced Surgery, and I'm a bariatric surgeon. And I'm very happy to be here.
Dr. Irgau, the volume is still a little bit low.
My volume?
Okay, now it's better.
Okay, I will just speak up then.
All right, that's great. Thank you. So one reminder that I just want to actually maybe just, I will start with that reminder, Dr. Irgau. So we have done several different events together, and of course, CHRIAS surgeons have done so many of them in the past. So what I want to actually share with everyone over here first is why we are doing this and in this format, and why we are actually dividing them into small pieces so that it's that there's a purpose for that, and then for us to be able to deliver this to everyone, to our patients or our future patients, existing patients, so they can actually watch these videos after we are live because they're going to be recorded. And now we are actually revamping the YouTube channel of CHRIAS. These videos are available. So we actually index them in a playlist in a format that is easy to follow. Like as you can see, this corner is just a screenshot. So what can I expect after I have bariatric surgery? Bariatric surgery times by Dr. Irgau, before weight loss surgery, why do patients drop? Now, this will be the care coordination piece that we are going to discuss. In total, actually, all of them are all together, but you can understand how sometimes in a way how lengthy this process is. We want to make sure that this is easily available for our patients, especially the time that we are going through right now with the pandemic, which maybe even after the pandemic, certain things will be visible. I mean, it's going to be permanent in my opinion, at least. Dr. Irgau, if you can just give some background on the group in case there are some of our patients that are just seeing this first time.
Absolutely, yeah. Thank you, Kemal. So these are the surgeons at the Christiana Institute of Advanced Surgery, or CHRIAS. There is myself, there is Dr. Gail Wynn, Dr. Michael Peters, Dr. Rahul Singh, Dr. Sachin Vaid, Dr. George Abraham, and Sydney Manbeck, who is our physician assistant. Except for Dr. Vaid, who is a colorectal surgeon, all the other surgeons are bariatric surgeons, which means they are weight loss surgeons. Now, by training, we are general surgeons, but we specialize in weight loss surgery. That is weight loss surgery undertaken through small incisions, which is also known as minimally invasive surgery. Our group has been doing this for almost 20 years now. It is the most experienced group when it comes to weight loss surgery or bariatric surgery in our area. We've performed over 7,000 procedures successfully over the years. And in terms of experience, really, there is no parallel in our area.
And that actually makes one of our point in this, what we know, what we learned in time in the last 20 years, what we were able to build on the foundation of what we started, because there's not only one type of surgery in bariatric, and there are new surgeries in time, and the change that happens with the bariatric. All these are different things that's making it in some ways a little bit more complicated. In some ways, maybe it's easier to access. So one, I believe, one advantage that we feel like we have is we have our surgery center where we actually specialize in bariatric, 90% of our business, which actually makes everyone more experienced in bariatric. So,
absolutely.
Dr. I mean, let me know if you disagree with this. And, you know, today we are maybe a little bit more excited than normal because we are right now live in 3 different platforms.
Yeah, wonderful.
And that through Switchboard, we have done this. So it's actually really good to be able to reach out to more people at the same time. Now, one of the things that I want to make sure that we kind of emphasize on the most experienced group, this is not just basic for surgeons, but it's also for the entire team. Now, I'm going to include myself in this because I'm not a surgeon, I'm not a physician, and what I know, how much I learned from you and from our team, from our program, that's priceless. So now, Surgery Center with the staff, if you can kind of elaborate that for us, why it's important for nurse or what it really means when we have a focus group for this bariatric patient, so that we can start from there.
Absolutely, absolutely. So, you know, as we've talked about many times, patients who suffer from morbid obesity, and they look for options because they have failed to lose weight time and time again, and very often feel really guilty themselves, thinking that it is them who are failing without really comprehending that they are battling a disease that is entrenched in their biology. Therefore, it is the natural thing to happen for them to fail when they try with diet time and after time. When they hear about bariatric surgery for the first time, actually most people reject the idea. It takes time for the idea of weight loss surgery as an option for them to mature in their head. And once that has occurred, they want to go to a place which is safe for them, which will embrace them, which will work with them, which will understand them. And that is an experienced place, right? You want to go to a place where people look at morbid obesity as a disease and they act on it professionally, supporting the patient in every way, whether it's emotionally or physically. So patients feel at home because they come to a place where there are chairs that are able to accommodate them, where they don't have to struggle to find a place where they can sit, where there is sensitivity to their needs and to their understanding about surroundings. Because remember, they have gone through their life feeling ashamed about the weight they have, go to meetings when meetings used to happen in person to try to find the chair that will accommodate them, and they would go to meetings early because of that, right? So that kind of stigma that society has put on obesity is one of the really biggest problems that they face. So going to a place where this is very well understood is imperative. And having a team that has this long experience in treating patients with morbid obesity is the actual place where they will feel not only welcome and safe, but where they will create treatment really to the highest standards just because thousands of patients have gone through that system before. And that's really what the experience is, Kemal.
Absolutely. Now, Dr. Yao, one of the part that I do want to kind of elaborate for the patients is the different terms that we use. So there's the multidisciplinary teams and there's the care coordination. Today, we are going to talk about more on the care coordination, but can you actually explain the multidisciplinary approach in bariatric, and then we'll go into the care coordination after that?
Absolutely, absolutely. So remember, a very important point here is that when people suffer from obesity, that brings with it a plethora of illnesses and conditions that come with it as well, whether it's high blood pressure, heart disease, diabetes, sleep apnea. Now, normally, all these medical conditions will have their own specialists to look at them, and patients have gone through all that to try to address each problem at a time. With bariatric surgery, we're saying, let's go to the source. That's obesity is the main problem here. Let's address it with bariatric surgery. Having said that, as we prepare patients for the surgery, we want to make sure that their medical conditions are optimized. Therefore, we have to make sure that they are seen by a cardiologist if it's needed, that they are seen by a pulmonologist if it's needed, they're seen by an endocrinologist if they're needed. I can give you a simple example that you and I go through during preparation with in our care coordination meetings. We check something called A1C, right? Which is a blood test that looks at how the blood sugar has been behaving over many months in a particular patient. Now, when the A1C is too high, we know that the blood sugar control was not good. Now, we know that surgery outcome actually can be compromised if the A1C at the time of surgery is above a certain level. If we see that in our preparation, we will make sure that patient goes to their primary care doctor, that they will go to their endocrinologist. So this is not about bringing a patient, send them to surgery for the surgeon to do the surgery and then go. This is about preparing the patient for the best outcome. Therefore, all the specialists that need to be involved will be involved. This is from the medical preparation point of view. But there is the other preparation, which is the nutritional education, the psychological assessment, making sure there are no gastrointestinal problems by doing endoscopy. All that requires a very well coordinated care involving multiple disciplines. So multidisciplinary is that. And then the care coordination is the background work that our team does to gather all that information and to help patients navigate all these clearances and visits that they need to have.
So well, in a way that care coordination is helping the patient to connect those dots between the different appointments, different specialties that they have to go through.
Absolutely.
Now, including myself, with you and with our team, we go through this every day. We are spending close to 75 minutes, a little over an hour every day, and we actually work on patients who are going through the program already, who have surgery dates, and then we have patients who have who are about to get a date, but then they don't have enough clearances. So we work with the entire team. Now, our team actually reaches out to the patients directly. In some of those meetings, case conferences, we call the patients just to kind of see what we can do, if we can help them. And then part of the issue that we actually kind of learn by now, that this issue that we have is, I'm getting a message from here, but I think, I shared the wrong screen. Okay, so this is always good to have someone in the room. So I am sorry, I was apparently sharing the wrong screen, but then at least you saw how we were doing this. That's the 4 different accounts that we are sharing. We are going live. So what I was saying with the care coordination, the work that we do, and the reason actually we are including this in our video is so that our patients should also know what to expect, who's going to help them, how we are going to help them, how often we are going to help them. We from United Medical, with the leadership from Dr. Irgau, we built this database, we customized this database. Then actually, before in some programs when they were actually managing this care coordination with simple Excel files, we took that to a different level. So then there's a better accountability from our side. So then even if in some cases patients may be struggling to go through, we are there to help them, but then we have a good database to keep track of what's happening. Now, I do want to give one example, Dr. Irgau. You mentioned the A1C, and when I was going through some of these during the case conferences, I take notes. And one of the reasons that I'm doing it, either I'm going to follow up with them or I'm going to actually include some of those examples in this meeting. And the A1C, how important that can be and why the care coordination is the key for these. Now, for our Medicaid patients, we have contracts with MaryHealth and with Health Options. Unfortunately, they require 6 consecutive months nutrition. So if you miss 1 month, let's say if you are on the month number 4 and you miss that, you may need to start everything all over again. So that becomes so critical. Yep. So when we have that time for almost 6 months, we also want you to get A1C and the TSH test blood work right in the beginning. Now, sometimes I see the delay from our patients, and why we actually push that earlier is because if there are any abnormal results, then we have enough time, and then take that patient add the endocrinology into that multidisciplinary team, so then we can actually get everything ready before it's too late or before we skip a month. Now, from that point, Dr. Erkan, one of the issues that we still have time to time is the understanding of the role of care coordinators. We have different level of people in there, and then they are all expert in what they are doing. what can we do differently, or how we can actually make this a little bit more efficient if there are any pushbacks either from the patient or from the other side? It's time where it's kind of difficult to make every appointment every month. There are so many of them. What can we do differently from the care coordination side?
So I think we're doing great, to tell you the truth. I mean, I see how hard our care coordinators work. I've seen how much really they have progressed over time in terms of really themselves understanding the intricacies of preparation for bariatric surgery, right? And so because of that experience, and because they are in very frequent contact with the patients, they are actually the best people to help out when issues occur, right? A patient with sleep apnea, diagnosed with sleep apnea that requires a CPAP machine. Well, getting that diagnosis, getting that CPAP machine is a process, right? The patient has no idea how to go about it because it's not something they do every day, right? So having a care coordinator who has helped many patients before through that same issue is critical, because for the care coordinator, they will understand where the gaps are and how they need to be filled, right? So what can be done to improve this is make sure when I see patients in the office for the first time in my consultation, I make sure the patients understand how critically important the bariatric coordinators are for their care, how important that communication is. If they get a text from the bariatric coordinator, if they get an email through the patient portal, which is the secured email from the care coordinator, to make sure they follow up on that, because that care coordinator is holding up a process until they get in touch with the patient so they can guide them. So I think we also as surgeons, and I talk about this in our meetings with our surgeons, as you know, is that we have to make sure the patients understand how helpful the care coordinators are, how priceless having that kind of assistance is for them. Because remember, as we said, when patients are looking from outside at bariatric surgery, before they even consider bariatric surgery, it's confusing. It's a black box, right? Lap band, sleeve gastrectomy, gastric bypass, weight loss, clearances, the multidisciplinary, these are all terms that mean very little to them from the outside, right? So they come for the consultation, or they attend a Facebook Live event like this, where we start digging into some of the terms and talk about them, and they start really understanding, right? They come for the consultation, we talk about what the gastric band is, what the sleeve gastrectomy is, what the gastric bypass is, what the differences between those procedures are in terms of risks at the time of surgery, in terms of long-term complications, in terms of weight loss, in terms of resolution of comorbidities, to educate them. But that education process will continue as they go through the multidisciplinary process, because when they see the cardiologist, they may ask questions to them as well. When they see Fran or Amy or Beth, our nutritionist, they may have questions for them as well that will help them. But how about making sure they show up for that appointment with Beth or with Fran or with Amy? The care coordinator can help, because the care coordinator will have access to the schedules of all these people, and they can see. So rather than wait on the phone to try to talk to a receptionist in an office and then leave a message and they will go back to them, having that person as a linchpin to help them is great. And I have seen this throughout the almost 20 years in which I have been practicing bariatric surgery. I have seen how immensely helpful this has been for our process, not only in making sure there are no problems in the process that are not uncovered and addressed, but how efficiently, and we have less patients dropping out the process also because of that. And I think in the long term, that is helping greatly. That is a huge achievement in terms of addressing a medical problem.
So this care coordination part of the business, actually, Dr. Irgau, when in the past I felt like, and again, this is kind of my maybe personal opinion, when we were not able to work with the facility that we had the full freedom, we were limited with resources. So one of the things that we did from the program side, we hired care coordinators who are employed by the facility, by American Surgery Center. And now I was sharing earlier, I'm going to share it again. So this, prior to pandemic probably, this picture, they're not us, but hopefully we are better looking than them. But this picture is something that we were doing on a regular basis. Now we do this in a video setting, and everyone is participating from that, but also just kind of having the flexibility and the freedom so that we have enough people, we can call the people, we can have like daily case conference. You and I, we went to so many different bariatric conferences, and our surgeons, our other surgeons as well. It's unheard of.
Yes.
Now, the reason we are able to do it is because we understand that this is our specialty and this is our expertise, and we want to master this in a way that no one else can actually do this better than us. Now, even from someone from non-clinical setting like myself, when I now know the patients' names, and then I already know when we start the next round every week, I know who they are, how many, if like their COVID test results, their A1C, where we send them. So that actually adds tremendous value. But the reason we are doing it is to make it easier for the patients.
Absolutely.
So we know that this is challenging, and we know that we want them to take advantage of what's available for them. Now, does it have to be done at our level? Well, in my opinion, yes, it does have to be, because this is a serious business. It's really important for these changes, for patients to adapt for these changes. And we are trying to make this as seamless as possible from our side. Anything else you would like to add? And I'm going to check some questions from our.
No, I mean, I think, you're absolutely right, Kemal. As I said, it is by itself a huge burden for patients to really accept the idea that they have to have bariatric surgery, and not to have the right crutch, the right support as they go through this complex process of preparation is a problem. But when they have the right support, Kemal, when we give them this, then it makes it a lot easier. And we owe it to our patients to do that. You know, we are their home. We are there to help them. So doing this is, critical. It's vital.
Definitely. Now, I'm going to check with Tanner. Tanner, do we have any questions that we didn't cover in this?
I do not see any at the moment.
All right, then. So what I would like to just remind everyone again, let me just share the screen. So the digital health with the pandemic of coronavirus management, how we actually change from the practice, from the patient, from the, like personally, everything changed for us. Now, you were doing telemedicine prior to this.
Yes,
actually, I had to kind of adjust your schedule from the patient time. Now, because we do that at 3 p.m. Why are we doing it at 3 p.m.? Because we want to make sure that there are enough people available at 3 p.m. But then we make this offline available. Now, that's kind of helping us complete the digital health record, so that it's not just the electronic health record, but what support the patient needs. So this actually, we are trying to improve this every day. The videos are going to be available, are available through Facebook already and YouTube. But on YouTube, we are trying to actually streamline them so that it can be easily accessible based on the topics. And please take advantage of what we have here and what we are doing for you, for our patients. Now, next week, we are going to have another event like this. This time, actually, I'm going to have Dr. Mike Peters, who's going to join me, and that's going to be at 4:30. Now, the reason we make those changes is because sometimes we adjust them based on the patient, their patient schedule. So then he finishes at 4:30 and he'll join us. And we are going to actually talk about the complications after bariatric surgery and how we can actually prep for those complications. Now, Dr. Gano, you need to go back to your patient hours, and I do thank you for joining us.
Thank you.
Again, this is possible by CHRIAS and American Surgery Center, and we are happy to be able to help everyone. And please stay tuned, and we'll see you next week. Thank you so much again.
Take care. Bye-bye. Thank
Bye-bye.
you.